Hey everyone out there, it's Roberto Miki again, and we've got another great hand question of the week. It's number 57 in our series. It's May 18th, 2025. Well, let's get right into it. This is a question based on a lecture that we went to at the Orthopedic Grand Rounds at Yale. It's also based on an article from Cell Research that was published in January of 2025. It indicates the topic is tau receptor and osteoporosis. In a recent article by Fu et al. In Cell Research describing the role of tau in glucocorticoid-induced osteoporosis, all statements about tau are true except A. Tau knockout mice demonstrate less glucocorticoid-induced osteoporosis. B. Phosphorylation of protein tau serine 422 was responsible for glucocorticoid-induced osteoporosis. C. Tau tubulin kinase 1 is responsible for protein tau serine 422 phosphorylation. D. Tau is a microtubule-associated protein. And E. TRX0237 led to a decreased glucocorticoid effect on inflammation. Well, here's your chance to pause the video, think about the question, and answer it. Explanation. Tau is a microtubule-associated protein, which is currently most well known for its role in neurological diseases such as Alzheimer's. Tau receptor or tau inhibitors are being used or are being trialed in Alzheimer's to see if they are effective in reducing Alzheimer's symptoms and also its advancement. Tau also plays a role in glucocorticoid-induced osteoporosis, as shown in this article and in this question. When the protein is blocked, glucocorticoids still reduce inflammation, but the osteoclast-induced bone loss is blunted. Phosphorylation of protein tau serine 422 by tau tubulin kinase 1 is responsible for the activity of tau in the bone loss. TRX0237, which is currently in trials for Alzheimer's and is similar to methylene blue, can block the effect of tau in glucocorticoid-induced bone loss. TRX0237 does not inhibit the glucocorticoid effect on inflammation. Well, here is a drawing from the article, and basically it shows on the left side the normal sort of effect at physiological levels of glucocorticoids. But when you get elevated levels of glucocorticoids from medications, the glucocorticoid, because the tau protein has a low affinity for glucocorticoids, when the glucocorticoid levels rise to a certain level, it can cause the tau protein to become phosphorylated, and it gets phosphorylated at the serine 422 amino acid, which then causes tau to be activated and then causes a cascade which is involving P50 to cause osteoclast genesis. And so you get an increased osteoclast activity during glucocorticoid activity levels and elevated glucocorticoid levels, and so consequently you get the disease of osteoporosis induced by glucocorticoids. In any case, here is a table or a drawing from the article, and it basically shows the animal model that they were able to use. In sort of part A, you can see the black line represents what happens to the mouse model, that is a mouse model for rheumatoid arthritis, that if it's not treated, basically the rheumatoid arthritis goes out of control and you get inflammation in the joint and you get this clinical score for the mouse. If you give it steroids in the red line, then that inflammation goes down and the clinical score goes down. If you give it steroids and TRX0237, still the inflammation goes down and you can see that the clinical score improves. So the TRX0237 did not affect the clinical effect of the dexamethasone, which is a steroid. In letter B, in that sort of section of the table, PBS represents the control, and you can see that if you just give PBS to this mouse, they still get the inflammation in the joint, and the joint narrows, and you get all this inflammatory response, which are these like sort of pinkish cells here. And then if you give them steroids, which is this sort of middle drawing, which is DX, which is dexamethasone, the inflammation leaves the joint. And if you give dexamethasone with the TRX0237, which is the next drawing, essentially you see that the inflammation is still not seen in the joint. So basically the TRX0237 does not affect the ability for dexamethasone to cure the inflammatory response of the rheumatoid arthritis. But what you can see, though, is in these clinical sort of sections of the bone that the PBS, the bone density stays normal, but with the dexamethasone, the bone density decreases, both in the femur and the tibia, which is these bottom drawings. So in PBS, the bone density stays the same. The dexamethasone, basically, the bone density decreases. But when you give the dexamethasone with the TRX-0237, it looks like it blunts or gets rid of the effect of the steroid on the bone loss. So I think this is a great article, and still it's basic science, but this is something that probably will be used clinically at some point in the near future, especially if TRX-0237 gets FDA approved for, let's say, Alzheimer's. It might have a secondary indication for example, rheumatoid arthritis, preventing the glucocorticoid-induced steroid-induced osteoporosis. So you can imagine this being sort of clinically relevant in the next 5 to 10 years if they can get a trial going, or if they identify another similar medicine to allow for, or compound that would have a similar effect. In any case, this is the reference. It's by Wendy Fu et al. And this is research out of her lab. And it is an incredible article, I think, and really telling. And I think it's worth reading if you're interested in bone pathways. In any case, the answer is E. TRX-0237 led to decreased glucocorticoid effect on inflammation. In fact, TRX-0237, when given with glucocorticoids, did not decrease the effect of the glucocorticoids on inflammation. And the rest of the statements are true. And I think this is worth learning, as it probably will be clinically relevant in the near future. Well, hope you enjoyed this video, and we'll see you in the next one. Remember to like and subscribe to help support this channel.